Good morning, everybody. Welcome to eRAD Tips and Tricks. I'm Nancy Gillan, the Senior Application Specialist, and I will be presenting first of many short presentations for our customers. We've kind of decided that short little bits of information may be more beneficial for our customers. We know that you all have busy centers and may not be able to find the time for a longer meeting. We appreciate any and all feedback, positive or negative. The presentation will last about 10 to 15 minutes and is being recorded. It will be posted on our website for future reference. I will turn the recording off for a 15-minute question and answer period following the slides. eRAD has several ways to identify information relating to the referring provider, patient, visit, and exam. The first one that we're going to talk about today is patient flags. The second category is patient alerts. Then we have CDS alerts, referring alerts, and insurance carrier alerts. The flags themselves are auto-generated based on other variables related to the visit. These include stat pre-cert, IV2 required, stat exam, stat read, multiple exams on the same day, special accommodations, allergies, contrast required, sedation, clinical tasks, and AUC review. And I'm sure in future development, we'll probably see more of these in the coming years. So we're going to talk about these a little bit. We don't have an option to change the icon. They're inherent to the system based on other factors. So if the exam, for instance, on the contrast required, is designated in the procedure code table as contrast required, that flag automatically generates in the flag column of the patient work list. Same thing that if an exam is marked stat or stat read, those will automatically produce those icons for you. So it's pretty, system generated and not much configuration there. What you see is kind of what you get. Patient alerts are a little bit more complicated. They are manually added based on necessity and are completely configurable by your organization. So these can include anything you kind of want them to be. We can do it so it's at the order level or at the patient level. So saying that you have an alert at the patient level, that will carry through with the patient every time they come in until someone actually turns that alert off. If it's at the order level, you'll only see it for those exams that are ordered for that day, scheduled for that day, part of that complete order. Your system administrator can configure this table based on the facility needs. Icons can be displayed on many work lists, and options for pop-ups can be configured for specific screens. And I'm going to show you how you can do that. The icons, when they do come up on the work list, and this is just the way development kind of configures it, it's always the newest item is always the last column. So you will have to rearrange your work list to be able to see that column and bring it up front for people to be able to see it, easily rather than having to go hunt for it. Where you configure this is the patient alert table in the configure settings and the administration table. So now we'll talk about adding patient alerts. So as in anything else here in the system, we've got a code that can be entered here, and then you can have a description as well. This description is what will show on the pop-up screen. Display order, we have everything at one for right now. We can also prevent alerts from being in the patient portal or in the referring portal. Here is where we choose the level that we want it to show at. Do we want it at the order level or the patient level? And that will kind of prompt where it shows up. Of course, last updated, and here are where our icons are. So we have quite a few in this system. Just as a test, you can have as many or as few as you want. So on the alert icon selection, they do stand out with just simple graphics a little bit better than what you see. So let me show you kind of the difference. Here I have just a big, bold red R, obvious. It's going to look exactly what you see here on the work list. Here I have added one that had a lot more detail. And as you can see, it's a little bit hard to make out what that really is. It is a green check mark. It has a shield around it as well. Hovering over the icons in any work list will give you the full description. But, keep it simple. Keep it simple. Excuse me, let me back up here just a moment. You can use icons from clip art or any other graphics. Sometimes I just type a couple letters and actually screen capture that if I want a word or just an abbreviation, kind of like this R is. So that shows the icons will show on the work list. If we want an alert to be configured to warn on a certain screen, you have the expansion arrow or little triangle on the left-hand side. When you expand that, it duplicates patient flag code, and it's asking me what screen do we want to see this on. And this one I have configured for just the schedule order. I could have done it for schedule order and registration just simply by adding another row. This alert was added and configured to show at scheduling to let them know that the patient often misses appointments. So not only is it an icon on the work list, excuse me, but it's also going to pop up when they try to schedule a patient. So at least they know, kind of ahead of time what they're dealing with. Now, adding alerts to the patient are actually this little man here with the exclamation point upside down. When you add an alert, we are looking, by the way, at the patient folder, and the patient alerts at the patient level will display first. And then here you can see that these icons were specific to alert at that order itself, not on everything that's done on the patient. So that was order specific versus patient specific. Alerts will also show on the patient title bar. And I have the patient folder open. But at any point in the workflow, you will see those icons displayed next to the other patient information as well. And that is kind of version dependent. So some of you may not be seeing it yet. So these alert configurations are based on clinical decision support factors. So if you are using the MU page and you've added some of the information, for instance, the patient has had asthma and has had an allergic reaction, this alert will automatically kind of pop up. And then in addition to the ones that are inherent to the system, you can see that one was added here that the patient is deceased. Okay, so on that one, what you're doing is when you check the box that says the patient is deceased now, this is actually doing an alert configuration for you as well. The next type of alert that we have is a referring alert, and this is added into the providers in the personnel table. So here I have that the father and son have the same name. So what's happening here is just we put this in on both physicians. So when you choose that physician by that name, it's just alerting you to make sure that you have the right one when you're putting the order in. The other option is to display the alert, and you always want to check that box as well. Here you can see, and this is when I selected this physician, alert message came up. The minute I hit the name, it's telling me that the father and son have the same name. I have to acknowledge this alert before I can go any farther with this order, saying that I've read it, understand it, and yes, I believe I have the right. The next one is the insurance carrier alerts. So this is configurable in the carrier table. And this one specifically was that this contract does not include PET CT scans. Pre-auth is required for all CT scans and MR procedures, and a number to call for clarification if you need it. So this again is based on carrier, and you can add notes and alerts to the carrier that will pop up when you select that carrier on the work list. The next option we have for alerts are validation rules. And it's another way of generating alerts and warnings, and that'll be covered in another session. As you can see, I don't believe that anything that we showed you today actually stops you from doing anything other than acknowledging and then moving on. Validation rules can be a hard stop in the system. But again, we're going to cover that in another session. So now we're going to turn off the recording. Please turn off the recording, and we can do some question and answers. Do we have any questions out there?